My name's Dr. Meriel Raine. I'm a GP at 19 Beaumont Street Surgery in Oxford. I'm going to talk a little bit about the risk of having an IUD or an IUS fitted. These devices are extremely safe and effective contraceptive devices. Nevertheless, there are some risks attached to their fitting, which are uncommon, and you need to be aware of them before you make a decision to go ahead with the fitting. Firstly, you need to be aware that although they are extremely reliable, with a failure rate of something like 1 in 100 women over 5 years, there is a very small chance that you can become pregnant with one in place. If you should be one of the tiny numbers to whom this happens, you can have a pregnancy in your fallopian tube, a so-called ectopic pregnancy. The chances of this happening are lower than if you're using no contraception at all. Nevertheless, you need to be aware of it because that pregnancy will not continue and you are likely to need an operation and you might lose that tube. So it's a very, very, very low risk of this happening, but you need to be aware of it. Secondly, coils or intrauterine devices or Mirainas can fall out, and the quoted risk of them falling out is 1 in 20. I think that is definitely higher than my personal experience. Nevertheless, it's something that you need to be aware of. If the device is going to fall out, the most likely time for this to happen is in the first 1 or 2 periods after you've had it fitted. So the womb contracts with a period as normal and the device can be expelled. And usually you'll see it and it will be quite obvious, but some people don't notice. It's therefore important that you check the threads of your device, and it's best to do that monthly after your period, assuming you're having them. And if you're concerned and you can't feel it, you should contact your GP and get that checked out. Secondly, you need to be aware of a risk of infection. If you should have undiagnosed chlamydia infection, and most chlamydia in women is undiagnosed because it has no symptoms, in the first 20 days following IUS or IUD fitting, you're at risk of developing an infection, a pelvic infection, that can make you unwell and is important to avoid. For this reason, I always offer every woman that I'm going to fit a device in a chlamydia test. Your risk of chlamydia is increased if you're under 25 or if you've had 2 or more sexual partners in the last year. If you feel that you're at the low risk, you can elect not to have a test. If you're 25 and under, indeed anyone who's 25 and under, is eligible for the NHS self-chlamydia screening programme. You can obtain a self-chlamydia test which comes in a blue envelope from our reception or from many other places. So in our surgery you should get the test, go and do the test, fill in the form, return it to reception, and if you put your mobile phone number on the form where it's requested, you'll be texted the result in 3 working days. I recommend everybody 25 and under should go ahead with doing that. Finally, you need to be aware of the extremely low risk of a perforation occurring. This is a very unusual complication, but it does happen. The quoted risk for this is 1 in 500 cases. And in this situation, the device can pass through the wall of the womb and into the tummy cavity. And this can happen at the time of fitting, or it can happen subsequently. And you can be aware of it, but sometimes you're not aware of it. If that happens, you would likely need a small operation to have the device removed from the tummy cavity, and it's not going to be working as a contraceptive if that's happened. So this is another reason why I always tell people that they should check the threads of their device every month. and I'll explain how to do this when we fit the device. If you're unable to feel the threads coming out of your cervix, the most likely reason is not that one of these complications have occurred, but that the threads have coiled up and just gone back inside the cervix a little way. And this doesn't matter. They're usually easily retrieved, and it's easy to check where the coil is on an ultrasound test. But if that happens, you should not rely on the coil for contraception, and you should make an appointment with your GP or a family planning clinic to get that checked out.